Hello there, fellow Dallas County Medical Society physicians. It's Mark Casanova, your 2020 DCMS president. It's been a busy time for all of us in the last couple of weeks, certainly in the last several months. The pace has picked up significantly as of late, as we now are loosening the restrictions on the statewide level of non-emergent surgeries and procedures. We're also in the midst of closely watching events as they unfold, with loosening of restrictions on a societal level and retail to go adventures on the part of the community. I do want to commend our physician members. Each one of you has been a leader in the community and forwarding the message of public distancing, social distancing, hand washing, utilization of cloth facial coverings, face masks, and the like. All of this has represented and resulted in marked improvements of our clinical status in North Texas when it comes to COVID-19. We have very effectively protected our hospitals, protected each other in what could have been a very significant impact in North Texas. To that, we collectively should be proud of our efforts and the efforts of our society as a whole. I think if you listen very carefully to the news coverage and maybe to the sentiment about this, you're going to hear a very quiet whimper, and that is the whimper of success. There's not going to be banners hung from our hospitals proclaiming victory, nor should there be. We still have an immense amount of work cut out for us. But I think if we can continue to lead as physicians and as leaders of healthcare teams, as representatives of solo practitioners, of hospital-based teams, as specialists, as generalists, in the ongoing efforts to promote hand washing, promote safe, effective physical, social distancing, utilization of face masks, and the like, we can serve as a beacon of hope and as an example of how one effectively manages the upswing of a pandemic in a large metropolitan, urban, and even some outlying rural areas. We still have plenty of work to do. Physicians right now, particularly our surgeons and our intervention specialists, are trying to figure out how do we ramp up inpatient as well as diagnostic procedures. We've got our work cut out for us in that regard. Many outpatient practices that had been slowed and or shuttered in light of these restrictions are now beginning to open. We're all attempting to ensure that we have adequate PPE to protect ourselves, our patients, and our staff. So again, I think there is plenty of reason for us to hang our head high, to be proud, but to not forget that we still have a long road ahead of us. In that vein, my continued ongoing message to you and the message of the Dallas County Medical Society is to continue to care for yourself, take care of yourself, lean on us if you need us. We've got your back. We know we have yours, and DCMS is here for you. Stay strong, be proud, hang your head high, and let's enjoy the whimper while we have it.